A local hospital got a visit from Senator Tim Kaine today after a less than stellar review.
Yeah, last year, Defense Secretary Chuck Hagel released findings of a 90-day review of the military's health care system. Portsmouth Naval Medical Center was identified as an underperforming facility in some of those categories. And Senator Tim Kaine is joining us now here at 4 to let us know if anything changed.
Yeah, Senator, what did you see or learn on this trip today?
And I know many of your viewers have received medical care at the Portsmouth Hospital. It's the oldest hospital that the Navy operates since 1830. Thousands of visits a year, over 7,000 employees there. But yeah, in 2014, the DOD analyzed all the military hospitals, looking at 80 different categories of patient care. And in about 10 or 11, the Portsmouth Hospital was not at the standard that they wanted them to. And one that got some attention was infections after people are released from hospital care. Now, the report was based on data that was like 2011 data. So by the time the report came out, it was already looking backward. But look, I spent time with the leadership of the hospital. They take this very seriously. In a couple of the areas that were cited, even by the time the report was out, that they had done improvements. But they're very focused on areas where they need to improve. And I went there so I could learn areas where Congress can improve. Because some of the, we have some major budgetary challenges at the federal level. I'm on the budget committee trying to make sure that this hospital has the resources that they need. So it was really important for me to see what they're doing, talk to them about areas where they're, every institution has got good things and things where they need improvement, but also to hear what we can do better to make sure we support this hospital that provides such critical care.
You talked about ways that Congress can improve, and we've talked frequently recently about your push through the Senate Armed Services Committee, calling for Congress to debate and then vote on a new authorization against ISIL.
Right.
What's the latest on that, and how does Hampton Roads factor into this?
Well, Hampton Roads factors in a lot because, look, since the 8th of August, the president started a bombing campaign against ISIL, and we've got folks from Hampton Roads that are deployed there. So the Theodore Roosevelt Carrier Strike Group is over there. A lot of folks from the Norfolk area, thousands of American servicemen and women, a lot from here. But Congress hasn't done the thing we're supposed to do. We've got the cart before the horse. Congress is supposed to authorize the war, but a lot of my colleagues, frankly, they would rather not cast an unpopular vote. So they've allowed the president to start the war, and they've kind of been afraid to have the vote that they need to. But we've got to do this because we shouldn't be asking our people to risk their lives. We shouldn't be spending now over $2 billion. We shouldn't be having thousands of bombing campaigns without Congress debating and saying, here is a mission that is in the national interest. Now, the good news is I'm on the Foreign Relations Committee, and that's the committee that takes these matters up. I did get the committee to take a vote in December, but then it died on the floor at the end of the year. But I'm now working with the new committee chair, Senator Corker from Tennessee, to find a bipartisan path forward where we can act, and hopefully by the Senate acting, we can encourage the House to act too.
Well, Senator, we have so many questions we would love to ask you. We know your time is precious.
Well, then I'll have to come back.
Please do. Always invited. Thank you so much.
You guys.
We appreciate your time.